Yeah.
Okay. Hello, I'm Dr. Bittiker. I'm back again to do one of our presentations. We've been doing the pauses, cardio pause about the heart, or the brain pause. The pauses that occur that as you get older, your organs begin to fail, or at least not work as well. I thought we'd go off topic a little bit today. I just ran across an interesting article that might show you what part of the problem is here in America. You see, we're told that we are the best fed people in the world, and we're certainly among the most fed people in the world. We get the most food, but we're not necessarily the best. In fact, there's a common saying is that we may be overfed but undernourished. We see this a lot in people. I see this particularly in younger to middle-aged people. You know, when I ask them, like, what did you have for breakfast today? And I'll get something like, well, I had a cigarette and a Coca-Cola. I'm not making that up. I hear stuff like that. Or what did you have for lunch? Well, I had a McDougal burger or something like that. In other words, they're living on a junk food diet, bag of potato chips and a hot dog. And then they wonder why they have a lot of symptoms. Well, I can tell you that a lot of symptoms of deficiency diseases that you would think don't exist in America do exist. I mean, I'll give you an example that's very commonly mistreated, is osteoporosis. We're kind of told that you develop osteoporosis as you get older, particularly in women, and that is true to a certain extent. But also you realize that a lot of osteoporosis is simply nothing more than a vitamin D deficiency. All osteoporosis in an adult is what used to be called rickets in a child. If a child didn't get enough calcium in their bones or vitamin D, they develop rickets, a deformed skeleton. Well, adults get the same thing if they don't get enough vitamin D. So a lot of what we call osteoporosis and giving these expensive drugs can be due to something as simple as not enough vitamin D. A lot of times they blow right by the obvious and go to some exotic drug to treat something that doesn't exist. Well, let me tell you why this occurs. You see, you assume that your average medical doctor knows more about nutrition than you do. Well, you assume wrong. Here's a study. This is a journal of the American Medical Osteopathic Association. The conclusion of this was that the majority of medical students are, quote, overconfident and underprepared when asked about nutritional guidelines. This is reported by a Elizabeth Beverly, PhD, assistant professor at Ohio University, Heritage College of Osteopathic Medicine. There's a long-standing disconnect in medicine. In this particular study, they gave questionnaires to medical students, who, after all, should be the sharpest of all because they're just recently getting educated. And we found out that their education on nutrition is practically nil, very, very minimal. In fact, it's non-existent in some cases. And so my point is that many times you'll see these doctors have a case of nutritional deficiency, walk right in their office, look them right in the face, and it doesn't occur to them that they may be looking at a nutritional deficiency disease rather than something to be treated by a drug. And I'll give you some examples here. It used to be that years ago they used to paint iodine on people's toes or whatever. A lot of times you'll see people that come into my clinic, will do a test on them, and they're having all the symptoms of hypothyroidism. But we call it sometimes subclinical hypothyroidism because, well, if you run a thyroid test on them, it may be in the normal ranges, but it may be low normal. What are the symptoms of hypothyroidism? Well, did you know that high cholesterol is one of the symptoms? Fatigue, feeling cold, slow healing of wounds, losing hair falling out a little bit, losing hair on the edges of the eyebrows, also roughened skin. All these things, slow pulse, low blood pressure, all these things can be signs of hypothyroidism. Yet they may get a test. We do an iodine test on the patient, supplement the patient with iodine, and their symptoms go away. So what did they have? Did they have official hypothyroidism? No. They had subclinical hypothyroidism, or I prefer to call it just a sluggish thyroid for want of a better name. That's one example. What about this? How many of you have ever had, you get infected easily? You get, your gums may bleed sometimes when you use a toothbrush, and you bruise easily. And upset stomach, sometimes you get ulcers. Do you know what that can be a symptom of? Scurvy. They think that maybe you don't get scurvy. The only people that got it were the old times pirates who were sailors who would be on board a ship for months at a time and no fresh fruit, couldn't get any vitamin C. They would get it, and in severe cases of scurvy, you can die from it. You can bleed to death from it, hemorrhage, or you can become easily infected. Most commonly, people that get infections easily usually have some type of vitamin C deficiency. I've done vitamin analysis dietary analysis on patients, and found out they had zero consumption of vitamin C for years. I don't know how they were able to get by. And one of the dead giveaways is if you bruise easily, that's almost always a vitamin C deficiency. So, and again, I've had people come into my clinic who've gone to the doctor for this, had a glaring obvious symptom. I've had people that are getting ready to have all their teeth pulled, put them on vitamin C, stops the gum disease, that can keep their teeth. Because the doctor had been taught maybe about scurvy back in medical school, but didn't bother to think it through that maybe he'd be looking at a patient who has a really bad diet and has the problem. Let's go to some other possible nutritional deficiencies that you might see. Let me give you another one here. It's called beriberi. B-E-R-I, B-E-R-I, beriberi. How does this show up? Well, this is a B1 deficiency, a vitamin B1, a thiamine deficiency, vitamin B1. How does this thing show up? Well, it results in a degeneration of the nervous system. So you can have a person who has beriberi can start to have problems remembering things. They can start to experience twitchings in the muscles, also tingling and loss of feeling in the extremities, numbness and tingling. How many of you have been diagnosed with neuropathy? Your neuropathy could be coming from a B complex deficiency. You know, if you take a lot of antibiotics, it stops your bacteria in your colon from manufacturing the B vitamins. Thiamine is one of them. B1 is one of them. And you can induce a B complex deficiency just by taking antibiotics. Did you know that? That's why you should always take a probiotic along with an antibiotic. Not at the same time. Don't put them in the stomach at the same time. Keep them about an hour and a half apart. That way you can get the good benefits of the antibiotic, but also get keep your intestinal flora balanced like they should be. Here are some of the other symptoms of beriberi. The beriberi causes accumulation of fluid in the ankles, feet, and legs. How many of you have swollen ankles? Could be just a B complex deficiency. Also, it results in cardiomyopathy. People sometimes develop loss of the ability of the heart to function, leading to congestive heart failure, even death. That could be due to a B complex deficiency. I've seen this in my patients, and again, they're being treated by all kinds of exotic medications, and it was simply a nutritional deficiency. Just nobody bothered to pick up on it. One of the main inducers of vitamin B1 deficiency is alcohol. If you drink a lot, if you drink any at all, you should be supplementing with a B complex, particularly one that has thiamine in it. It will protect you a lot of times from the side effects. By the way, here's a little secret. Did you know that if you decide to go out and drink a lot, if you take along a couple of B complex capsules that have the B1, B2, B3, and all the supplements in there, and take a couple of those while you're drinking, you won't have as much of a hangover. I'm not saying it'll make it go away, and I'm not trying to enable you to drink more. I'm just saying is it will cut back on it quite a bit. In fact, there's some companies that actually manufacture stuff just for that. And here's multiple studies. Anyway, there's been lots of studies show that you can have remarkable reversal of the symptoms of beriberi by taking the B1 vitamin there. Okay, now let me give you another one here. This is pellagra. I'm going to type this out here. All right, now pellagra. Now, pellagra is a deficiency of vitamin B3. That's nice. In fact, my brother once developed this condition as a child back in the 50s. And I had to treat it with niacin deficiency. He did it, it happened to him because he was put on an antibiotic to treat a pneumonia. And when he came off of it, he developed chronic diarrhea. And then a month or so later, he's got pellagra. And I'll go over some of the symptoms here. But one of the symptoms of pellagra is a poor appetite. Number 2 is diarrhea. Number 3 is anxiety, depression, nervousness, and dermatitis, a key. You have like a flare up or your skin gets all flared up, and also a painful, swollen throat. You get chronic swollen throat, you got inflammation of skin, dermatitis, you're nervous, depressed, anxiety, got diarrhea, appetite loss, think about it, you might have a condition called pellagra. Pellagra is a vitamin B3 deficiency. By the way, also one of the ways it'll show up is in the form of arthritis. See this a lot. A doctor, I think it was Lindsay, did research on the use of niacinamide, which is a kind of a cousin of niacin, vitamin B3. It's a different form of it. He used that to treat patients who had severe rheumatoid arthritis and osteoarthritis and got really good results with it. He did some really good research on it. In fact, you can Google it up on the internet, see what I'm talking about, that was one of the more common things that were found. Let me give you some examples of some other nutritional deficiencies that show up. And this is the one that I learned about years ago. I had a patient that had, he was only in his 40s at the time. He was told he had congestive heart failure, plus he had extremely irregular heartbeat. And he was a hard-working guy. He drove heavy equipment for the state of Florida, one of these payloaders and bulldozers and all that. So he's out in the hot weather all the time. He started to develop swelling in the ankles and irregular heartbeat, and he went to see his medical doctor. And this is back in the 70s. And his medical doctor said, listen, you've got congestive heart failure, you've got cardiomyopathy, your heart muscle is wasting away. I can't do anything for you. You need to get your affairs order, because back then you couldn't do a heart transplant or anything like that. So you need to get your affairs order because you're going to die. And this guy was in his middle 40s. And so I've been doing some research on it, and I placed the guy on some B complex because I didn't know what else to do. I put him on some ubiquinol, which is a form of coenzyme Q10, which has been shown to reverse cardiomyopathy, which he had, because that was a vitamin deficiency, and also vitamin E. It's a special kind of vitamin E. It was a mixed tocopherol unesterified E. I put him on those three things, and within a matter of a month or so, his ankle swelling went away, his heart rhythm came back into normal range, he went back to work. And about a year later, he came back and told me, he said he popped a joke on his cardiologist. He went by to get a physical there, and the medical doctor about fainted because he was still alive. And in fact, he'd been outside working in very hot weather and doing a stressful level of work, and yet he could do it because he was in good shape. Well, anyway, he was obviously alive. He's still alive as far as I know, but that was like 25, 30 years ago. He retired a few years back, and he's still going strong. That was a case of a vitamin deficiency resulting in severe conditions. So there's also some indications that go to the vitamind.org, vitamindcouncil.org website. You'll see that all cancers worldwide can be reduced by 50% just by giving everybody enough vitamin D. You think that's important? Mineral and vitamin deficiencies are very, very common. In fact, probably half of your cardiac arrhythmias are caused by a chronic magnesium deficiency. We see this all the time in our practice. So your medical doctor is simply not trained to spot nutritional deficiencies. We are. So if you got a question, give us a call. 800-326-5838. That's 800-326-5838. Also, you can like us or share us with your friends. Let them know what we're doing. You want to have answered, you want to call me up or send me an email at
sbittiker@aol.com.
There you go. Send me an email. I'll answer your question. If I can't answer directly, I'll look it up on my computer database and give you a researched answer.
Make sure you include your phone number in case we need to get more information.
Yes, and so you will get a researched answer. All right? Thanks for watching. And back next time.
On Monday, we're back on Monday, and thanks to all our veterans for Veterans Day.
Yes,
tomorrow.
Thanks to our veterans. I really appreciate what you guys did for us. Thanks a lot.